Welcome to today's press briefing on COVID-19. We have with us Secretary for Food and Health, Professor Sophia Chan, Secretary for Labor and Welfare, Dr. Lo Chi Kwong, Controller of the Center for Health Protection, Dr. Ronald Lam, and the Deputy Director of Food and Environmental Hygiene, Ms. Diane Wong. We will first hear from Professor Chan. Friends from the media, people of Hong Kong, yesterday we have confirmed a case carrying N501Y and E484K mutant virus strain. It is a 39-year-old foreign domestic helper living in Caribbean coast in Tung Chung. The helper in question has already arrived in Hong Kong a while ago, so we believe that she was infected in the community. That means it is the first case, a local case, unlinked to other cases which carry the mutant strain. There are signs that there is a hidden transmission chain of mutant virus. We will closely monitor the situation. Given the fact that mutant strain is more transmissible, the government has attached a lot of importance to the situation. As soon as we found out about the positive testing result, we have immediately imposed the latest restriction and testing notice of the building involved. There are about 950 residents who have been tested. They are all tested negative. We will not let our guard down because the mutated strain may have a longer incubation period. So all the residents in this building are classified as close contacts, and they will have to go through the 21-day compulsory quarantine in order to cut a potential transmission chain. The confirmed case during the incubation period and the infectious period has gone to the community in Tung Chung and Tsing Yi. The contact tracing office has lost no time to trace contacts of the confirmed case. The close contacts as well as their family members have been contacted. They will have to be tested under the compulsory testing notice. There are five places where the confirmed case has visited. They have been included in the latest compulsory testing notice as per the press release last night. There are a lot of people who have been to these places, so I'd like to appeal to residents in Tung Chung. If you've been to any of these 5 places, please get tested as soon as possible. Before you get the test result, stay at home. Shortly afterwards, Dr. Lam of the Center for Health Protection will give you more information on the COVID situation. Well, yesterday's confirmed case is a foreign domestic helper. A previous confirmed case with N501Y, case number 11730, is also a foreign domestic helper. Given the fact that the mutated strain is more transmissible and the fact that these cases are unlinked and untraceable, and the fact that the confirmed case during the incubation period and the infectious period has met other foreign domestic helpers, we would ask all foreign domestic helpers in Hong Kong to get tested before the 9th of May for out of caution. Those who have received 2 doses of vaccination and they've waited for 14 days, they don't have to get tested. They will be exempted. And those foreign domestic helpers who have been tested today do not have to be tested again. Tomorrow is a public holiday. I ask domestic helpers to avoid attending gatherings, to avoid sharing food or attending other social activities. If they have to attend any gatherings, then they should keep their masks on, wash their hands regularly, and keep their social distance. Employers of foreign domestic helpers will have to closely monitor the health condition of their helpers. Should there be any symptoms, please ask them to go see a doctor. We'll hear more from the Secretary for Labour and Welfare. Given the current situation and the fact that there will be an increase in testing demand, we have added more mobile testing stations on top of the one already in Tung Chung Estate. I understand that there is a long queue at the Tung Chung mobile testing station. We have taken immediate action. In the afternoon, we have added another mobile testing station at City Gate shopping mall. We will continue to identify more locations to add more testing stations. We thank the public for their patience and cooperation. Given the increased demand, we will extend the deadline of the testing period of those 5 places to the 2nd of May so that people will have more time to get tested on Sunday. In order to meet the additional demand from foreign domestic helpers who have not completed their vaccination, we have already worked on increasing the testing capacity of our community testing centers and the mobile sample collection stations. We've worked with the Labor Department, which will provide testing at another 6 mobile sample collection stations over the weekend where foreign domestic helpers gather. We will also extend the operating hours of the community centers to 10 p.m. in the coming 2 days. So foreign domestic helpers can get tested between the 1st and the 9th of May. They can also make use of the online booking system in order to save time. I'd like to speak about our work in relation to mutated strain. In mid-April, we have first identified a case of N501Y in the community. The CHP has been conducting the work on tracing, testing, and quarantine. The government, once they have got the sample of preliminary positive cases, they will conduct genome sequencing to monitor the situation of mutated strain. Excluding the case yesterday, we have identified 3 cases carrying the mutated strain, and they are local cases. We treat them in the same way. First, once we have identified a case with mutated strain, we will, in the same evening, issue restriction and testing notice or invoke evacuation operation. Those who live in the same building as the confirmed case or those who stay on the same floor in the hotel as the confirmed case will be sent to a quarantine center for 21-day compulsory quarantine. At the same time, the contact tracing office will trace contacts of the confirmed case and send them to the quarantine center. They will also contact those who live with the close contacts to get tested under the compulsory notice. Places where the confirmed case has been to will be included in the compulsory testing notice. Out of caution, these people will have to get tested twice or even 3 times in order to cut any potential transmission chain. For today's compulsory testing notice, we will also include places where some of the other confirmed cases have been to, namely Cheung Chau and Harbour City. They people will have to get tested for the third time. I understand that these measures will cause inconvenience, but we have to take into account the risk brought by the mutated strain. We have to err on the cautious and careful side. We ask for your understanding. We'll take into account the needs of residents. We will take stock of our experience and continue to review our operation to see if there is any room for improvement. In terms of prevention of imported cases, it is very important. We see that the global pandemic is worsening. We see over 100 places or countries that have been ravaged by the mutated strain. We have last night further tightened the place-specific flight suspension mechanism. On top of the original requirements, if there is a total of 10 or more passengers confirmed positive by any tests with N501Y mutant strain or relevant virus mutation within a 7-day period, the flight suspension mechanism would be triggered. We would also take into account other factors and conduct risk assessments to decide whether we'll continue with the flight suspension. We have already announced that those who are coming from, we have extended the prohibition of passenger flights from India, Pakistan, and the Philippines from landing in Hong Kong. Starting from the 1st of May, passenger flights from Nepal will be prohibited from landing in Hong Kong. Nepal has been listed as an extremely high-risk specified area on the same day as the other 3 places I've mentioned. And people who have stayed at these places will be prohibited from boarding a flight to come to Hong Kong. Well, we have seen the first unlinked, untraceable local case with a mutated strain. The mutated strain is more transmissible, so there is a chance that it will trigger another outbreak, and the scale may be more serious than previous ones, so we have to be very careful. According to the latest information of the WHO, the 2 authorized vaccines available in Hong Kong are effective to fight against the 2 mutated strains. So I ask you all to lose no time to get vaccinated. Even if you start your first dose tomorrow, you will have to wait for 5 weeks before there is any production of antibodies. I ask you not to wait. The world is scrambling for vaccines, especially in areas where the epidemic situation is serious. So we ask you all to cherish the chance available in Hong Kong to get vaccinated. We should all work together.
Let's now hear from Dr. Law Chi Kong. Good afternoon. As we all know, there's a foreign domestic helper infected with this mutated strain of COVID-19. It could well be a community infections case. Therefore, we have to be prepared for this. We know foreign domestic helpers take care of family members of their employers, especially elderly members. And they are very much like workers in elderly residential care homes or homes for the disabled. Additionally, we have to consider that during the holidays, they will meet with friends, and once they are infected, it could lead to cross-family infection. So from the perspective of prevention, foreign domestic helpers are considered high risk. For the past 6 months or so, we have been providing free testing for FDH, but the take-up rate was not very high. To prevent the spread of the mutated strain in the community, we have to strengthen our measures in respect of foreign domestic helpers. As Professor Chen has told you about the compulsory testing, and I won't repeat the arrangement here, starting from tomorrow and the day after, which is a statutory holiday, we would enhance our testing capacity to handle the additional demand. But in Hong Kong, we have 370,000 foreign domestic helpers. If they all go for testing in the coming 2 days, there will be long queues and chaos. Therefore, we appeal to employers and foreign domestic helpers alike to make the best use of our online booking system, whether they are going to get tested or vaccination. For the longer term, we have to consider ways and means to impose vaccination requirements in respect of foreign domestic helpers. So in the future, for visa applications, there will be additional requirements. Foreign domestic helpers will be required to get COVID-19 vaccination when they present the contracts to the Immigration Department for endorsement. And for tomorrow and the day after tomorrow, the Labor Department would work with various departments to conduct mobile broadcasting at places where FDH gather, to appeal to them to comply with the social gathering and face mask wearing requirements. If they cannot comply with this, law enforcement action will be taken. We also make the same appeals through the consulates generals in Hong Kong. Dr. Lam, friends from the media, I would like to report the COVID-19 situation. We have so far 11,775 confirmed cases and 209 fatalities. For the past weeks, we have recorded 152 cases. Imported cases account for about 80%. And for local cases, it's about 20%. We have analyzed local cases. About half of those are not linked to other cases. This goes to show that in the community, there are silent transmission chains. And if we let up on our measures, the pandemic may surge again. And also, I would like to talk about the mutated strains. As at the 29th of April, we have 203 cases related to the COVID-19 variant. 129 was the variant from the UK, 43 South African variant, and for these cases involving mutated strain, 75% of the patients was asymptomatic. So if we find cases in the community, we have to take up more prevention measures. As for the first one, first local case, we are talking about N501Y and E484K mutations. Apart from what Professor Chen has told you, I can also tell you something about contact tracing. We have tested 300 close contacts. Not all the results are out so far. But for the index case, the original case, the foreign domestic helper's case, a 10-month-old baby in the family was infected, and the parents have been tested negative. And lastly, let me say something about what we should watch out for. For this foreign domestic helper's case, she was infected on the 23rd of April. She coughed, and then she went to see a doctor on the 26th of April, and she was confirmed after being referred to the testing center by the doctor. So we would appeal to everyone to seek early medical attention if they have any symptoms. And also, people should stay away from crowds and avoid gathering, wear a mask, pay attention to hand hygiene. And we also would like to get everyone vaccinated as soon as possible. According to WHO, the vaccines we have are effective on these variants. So we will need to come up with a immunization measure in Hong Kong as soon as possible.
Please wait till you are given the microphone. Keep the number of questions to under 3. Identify yourself and the organization. I'm from the Apple Daily. I'd like to ask about the case of the foreign domestic helper. You said that she is infected a 10-month-old baby. What about genome sequencing? Is that also a case of mutated strain? Last night, Dr. Lam, you said that this case is currently unrelated to the previous 3 cases. Is it really the case that they are unrelated, or you don't know yet? Parents are tested negative. They have not yet been infected, or are you sure that they have not been infected? Yesterday was the first day of the vaccine bubble, and it so happened that there is local transmission of mutated strain. Will the vaccine bubble be affected? Will it be halted? Will the measures revert back to the last round? I'd like to ask about some details as well. Employees of catering establishment may not have to be vaccinated. How many of them do you think? The sector said that is a bit chaotic. Would you further explain the situation and the requirements to them? I think there's more or less enough questions. Let's first hear from the Secretary before deferring to Dr. Lam. Thank you for the question. We've just started with the vaccine bubble. Under the new direction of fighting the epidemic, it is the wish and aspiration of the public to get back to normal. We want to launch targeted measures and to avoid stop-start of the operation of various establishments. We use the vaccine bubble as a basis to gradually and in an orderly manner open up various premises. We impose requirements, say for example vaccination and other requirements. We have very vigorous measures to guard against imported cases and mutated strain. We try to stop them from getting into Hong Kong. And should they find their way into Hong Kong, we make use of different measures, say restriction and testing notice and tracing to curb transmission. All these measures are carried out in tandem. You talk about the vaccine bubble. We all need time to adjust. There are different scenarios and situations. The FEHD has issued guidelines and make available information on their website. They continue to talk to the sector. We continue to liaise with the sector to help them with the difficulties they encounter and to explain to them. About the case involving the 10-month-old baby, the result of genome sequencing we've just received carry N501Y and E484K. So it's very likely that it's a direct infection by the foreign domestic helper. The previous 3 cases in the community at this moment has shown no sign of epidemiological link. So we classified this as an untraceable case. The first one was an arrival from Dubai. We've worked with Professor Yun of the Hong Kong U to look into these cases. For the first case, a possible source of infection is the hotel in Tsim Sha Tsui. The second case, from the CT value, and the environment of the hotel, and the fact that the antibody of the patient is tested positive, we think that the source of the infection is not from the community. The third case is the one from Dubai. The third case is the female friend of the first case from Dubai. We have conducted genome sequencing and they share the same signs. So we reckon that from the epidemiological perspective, that those cases are not directly related to this foreign domestic helper case.
Maybe the Deputy Director of Food and Environmental Hygiene can supplement about the arrangement under the vaccine bubble. It means in the directive we have issued, we will request that catering premises which are interested in offering Cat C or Cat D services, they would provide simple statistics to the FBHD. For example, the number of vaccinated employees. We just started this for a day, so the statistics will come in due course. And secondly, liaison with the sector. Well, this is a new arrangement. So in this initial stage, what we would like to pay attention to is public education. Last night, colleagues from the various departments visited these catering premises. We explained to them how this vaccine bubble program worked. And during the meal times, we met with the representative of the catering industry, and we have responded to their questions and comments. We'll maintain the close communication with the industry. The speaker's not using a mic. Initially, we would pay more attention to publicity and public education. We'll pay attention to the development and adjust our strategy accordingly. The lady in grey. I'm from Ming Pao. I have a few questions. For the two secretaries first. Our vaccination program is always said to be voluntary. And now if you ask foreign domestic helper to get vaccinated as a compulsory requirement, would that go against the original principle of the vaccination program? And would this be extended to other professions in Hong Kong? Or are you going to ask people of certain professions to get vaccinated? As for the 39-year-old FDH case, when will the DNA test results be out? can you tell us whether the DNA sequencing result is similar to other cases? We have 10 cases, 10 consecutive cases of B1617 and also one B1617.1. It said that the previous rapid testing cannot detect L452R and E484K. Or is it because you didn't test for such a variant, therefore you actually didn't know? And last time we stopped flights from UK very quickly, and that was at the time when we didn't have N501Y, and so there are now so many cases coming from India, and we waited for so long to start flights from India. Was that the reason that the infection has now been spread to the community? Secretary for Labour and Welfare. Well, when I talk about the contract renewal or change of employer application from a domestic helper and also the visa application, well, as I have said, we have considered that foreign domestic helpers are employed to take care of family members of their employers, including elderly family members, and also usually on their rest day or on public holidays, foreign domestic helpers will meet with friends or other foreign domestic helpers from the same country. So they do face a higher risk. So in processing such employment visa applications, we'd like to get them vaccinated first. We know that after the completion of contract, the foreign domestic helper will return to her home country. We have encouraged and make arrangements for the extension of such a home leave, and many have applied for extension of the original contract or to defer the going back first. But since they are away from home for some time already, many are anxious to go home. But when they return, and the fact that there's a high risk of infection imported into Hong Kong, therefore, in order to guard against importation of such cases, we will require, as a matter of visa application, that such a vaccination requirement be met. We have 370,000 FDH. Their contracts are for 2 years, so on average, 500 or so foreign domestic helpers would have completed their contracts. The contracts could be extended or renewed, or they can work for a different employer, or they can leave Hong Kong. So we are not asking too much as a matter of a visa application requirement. And since they are not local residents, and in view of the requirements to fight the epidemic, we do think this is a necessary requirement. And also, we don't know globally when the epidemic would ease. So it's also a way of encouraging them to get vaccinated. And of course, they do have a choice, but they're in a different situation vis-a-vis local residents. Friends from the media asked a question about the measures to prevent imported cases. I'll say something about that, and I'll ask Dr. Lam to talk about our vigorous measures to prevent this. As mentioned by the reporter, when we first discovered a UK mutated strain, we were very anxious to get something done, so we suspended the flights from the UK to Hong Kong at once. Of course, the CHP has got a mechanism to monitor the global epidemic development. And we have been gathering information. And subsequently, we have South Africa and all islands listed as a high-risk area. We have a standing mechanism to suspend flights, which has been working very well. All along, the Center for Health Protection will analyze cases imported from other places, and also the development of the epidemic in other parts of the world to see if we need to do more in prevention. As the global pandemic rages on, in April we tightened up the flight expansion trigger mechanism, so it will be it would mean that we were not just suspending flights from certain airliners or locations, but for designated countries. But we do not make announcements about how many flights have been suspended because of the mechanism. But many of these flights are from potential flights from India, and now Pakistan and the Philippines are also covered. We will not allow anyone to board a flight from these countries for trip to Hong Kong, and now Nepal has been included. I'll ask Dr. Lam to talk about the rigorous measures that we're taking.
We have a very vigorous monitoring system vis-à-vis mutated strains. All confirmed cases in Hong Kong, since we have introduced the genome sequencing screening, we conduct a preliminary genome screening of all confirmed cases. This will help us identify any possible mutated strain. It's a very sensitive screening mechanism. It enabled us to quickly identify cases carrying the mutated strain. When the virus is spreading across the globe, it keeps mutating. The WHO has defined 3 mutated strains of concern. They are those ones that are first identified in the UK, first identified in South Africa, and first identified in Brazil. There are many different types and forms. But before it is shown that they pose a serious threat to the world, say for example high transmission, or the fact that they cause serious conditions, they will not be classified as mutated strain of concern. We follow the 3 strains of concern. As per the WHO, we have E484K and L452R on top of N501Y. After conducting the screening, if we have to conduct further investigation on genome sequencing, it will take a few days. If we are to make comparison of linkage, say epidemiological linkage, we will need a bit more time. As the Secretary said, from the start of the epidemic, it's been over a year. We have built a very sound mechanism to guard against imported cases. We have very stringent requirements of testing. We classified different places as high-risk areas, extremely high-risk areas, and we impose quarantine requirements. The global outlook is worsening. According to the WHO, for a consecutive 9 weeks, the number of cases has been increasing. Last week, 5.75 million people have been infected. And over just 1 week, over 80,000 people died. And the mutated strain is spreading. For the UK mutated strain, it has spread to 139 countries. For the one in South Africa, it has spread to 87 places. It's not easy to keep the situation as it is in Hong Kong. And we have to continue to be cautious. We have to exercise vigorous discipline to observe good personal hygiene, and on top of that we have to get vaccinated. The epidemic at the moment has subsided, but there is always a chance for it to resurge. So we need to get vaccinated to build a protective barrier. Well, how many cases of mutated strain from India? Are there any signs that it has spread into the community? For B1617.1, there is 1 case. If we are to conduct the full genome sequencing, it will take time. It's an imported case. It's not identified in the community. Let me supplement what Dr. Lam said. Dr. Lam said that the global pandemic situation is serious. We see an increasing number of infected cases and fatality. The mutated strain poses a challenge to us. We have sufficient supply of vaccine. According to the latest situation of the WHO, the 2 types of vaccines available in Hong Kong offers an effective level of protection against the mutated strain. We can't control the pandemic situation outside Hong Kong, but we can do something about our community. Please get vaccinated as soon as possible. This will give you a protective barrier. This will help us get herd immunity. This will protect us from mutated virus strain. The lady over there, I'm from cable TV. Just now you mentioned about the 10-month-old baby. What is their CT value? The baby is infected by foreign domestic helper. You now ask all foreign domestic helpers to get tested. How do you get that done? What about the families hiring foreign domestic helpers? Do they have to get tested? Well, some of the testing facilities have been suspended, say for example that of the BGI. You might have extended the operating hours, but are you sure that there is the capacity to handle all demand? This latest case of mutated strain, is it locally infected? Will you tighten the social distancing measures? Is it too late to do it? We'll first hear from the Secretary, and then we'll hear from Dr. Law about the foreign domestic helpers and other matters. We don't have the CT value now. We'll give you the information afterwards. About testing for foreign domestic helpers. Before the 9th of May, they will have to get tested. And from then on, we will tackle it by way of law enforcement. Over the weekend, the Labour Department will work with other departments to embark on publicity and law enforcement actions. We will incorporate testing requirements in the law enforcement action. Say, for example, if we see foreign domestic helpers gathering outdoors, we advise them not to do that. We'll advise them to abide by the social distancing measures and the group gathering restrictions. We will also ask them to show us a proof of test. Most of them have smartphones, and they'll be able to show the test result using their mobile phone. Professor Chan. Our testing capacity. Every day, we have a capacity of about 80,000. The deep throat saliva test kit is very popular. We receive half of the kits distributed. We ask you to make use of our community testing centers and the mobile sample collection stations. There is a lot of spare capacity because the prior booking quotas have not been used up. We will increase our testing capacity in a gradual manner. We've added new locations for testing and sample collection, say, for example, in Tongchong. We will identify suitable locations. Apart from existing community testing centers, we will also add more mobile sample collection stations. This time round in Tongchong, the hospital authority has increased the number of deep throat saliva test kit at their general outpatient clinics. We are aware of the surge in demand for tests. Apart from extending operating hours, we will also increase the number of sample bottles to be distributed. Regarding whether there will be any tightening of social distancing measures, we've always tried to work on making our measures more targeted and precise. The global outlook is poor, and we see the mutated strains ravaging the world. We have enhanced our measures in terms of flight suspension, specification of places in high-risk areas, and prohibition of passengers from certain places from boarding flights to Hong Kong. We've recently added Nepal. We have designated quarantine hotel, and in these hotels there is an infection control measure, and they've all been enhanced. We still have test and hold at the airport. We continue to pick up cases. We have strengthened the quarantine period. We've extended it to 21 days. We've also added requirements of testing during the quarantine period. On top of 12th day and 19th day sample, we've also added a requirement of 7th day testing. We have been enhancing our measures to guard against imported cases. In terms of our work to guard against the spread of cases. We have increased our testing capacity. We have increased manpower at the contact tracing office. They've been doing their work on tracing contact, and there is also the measure to impose compulsory testing notices. We have to make sure that these measures are well used. But you can see that we have been very effective in tracing contacts. On social distancing, we are aware that the public would like to see further relaxation. We've been doing this in an orderly and safe manner. We take baby steps. You may notice that the government is very cautious. We have to be cautious because we have to guard against imported cases and local spreading in the community. We have to put in place a vaccine bubble. Apart from COVID, well, we have vaccines available in Hong Kong that are quite effective towards the mutated strain.
Do you rely on an inspection? If they are going to be tested, can you cope? You have a capacity of 80,000 a day. As I've said, our testing capacity has improved, and now we allow a longer period, and also we offer more mobile testing stations and hope that they would use our booking system effectively. Let me supplement. This is what we have considered. We have now this confirmed case. That's why we have implemented the new measures. In the future, we are going to ask for regular testing of FTH. And we'll work out the details and then make suitable announcements. Let me tell you that the CT value of the baby case is 20. Let's have an English question.
Thank you. I'm from the South China Morning Post. 3 questions. Dr. Law, you said just now that domestic workers who need to renew their contracts in Hong Kong will need to get vaccinated. Well, what about domestic workers who are not in Hong Kong yet, like those who are coming in from the Philippines and Indonesia? Will they need to get vaccinated first? Would that be a problem because, for example, the Philippines and Indonesia, they are quite struggling to vaccinate their populations? Have you discussed with the consulates? The second question is about the community testing for the domestic workers. If you think that there's a need to test all domestic workers in Hong Kong, why not their employers? Why do you think that because the helper in Tung Chung is infected, then there's a need to test the domestic workers who is in Sha Tin? Can you explain the rationale a little bit? And then the last question is, are there plans to tighten social distancing measures? Because, for example, Professor Dr. He is he warned this morning that there might be a potential 5th wave. So at the same time, we have a potential 5th wave coming in Hong Kong. And then at the same time, you're allowing more people to have dinner in restaurants, allowing more people to have dinner in restaurants. So is that a bit contradictory? Are there plans to ban more flights? Thank you.
Okay, Dr. Law first, then Secretary Chan, please.
I'll deal with the first 2 questions. The first one related to those people who are now not in Hong Kong, and they are new arrival coming to Hong Kong to take up the domestic helpers role. We understand that there are demands, particularly from the employment agency, requesting the government to make such arrangement. But you know it's very difficult for us to make the vaccines available in the home countries like in Philippines or in Indonesia. Firstly, they have their own shortfall. And secondly, if you consider how challenging it is for us, even to arrange for testing or vaccination for outlying islands in Hong Kong, it will be almost impossible to arrange doing vaccinations, twice dose, 2 doses, 21 days or 28 days apart in different islands within Philippines, which is practically not possible. Now we are looking into the possibility how we can make the visa application process, how we can design such that they will be required to do vaccination. But there are a lot of technical difficulties and things that we have to look at. Once we examine how we can do that, we'll make those announcements if possible. But for today, most of the cases are actually who are renewing their visas instead of newcomers. Every day we only have now only a dozen or so newcomers coming into Hong Kong. And we'll be looking to how to do that. And so we will try to deal with those renewal of contracts, which basically today, on average, we have almost like every day 500 renewals of visas. So that is a very large number, and we hope that we can deal with that first. The details are yet to be announced. As to, in fact, the other reporter has asked a similar question, which I haven't answered, is why don't we require all the employers of foreign domestic helpers to do testing? You're talking about over 1 million people, okay? We're talking about over 1 million people. That risk is relatively lower. So it's a matter of priority. It would be challenging to complete the testing of 370,000 foreign domestic helpers in 9 days already. It would not be possible to require over 1 million people to do the testing in 9 days.
Okay, thank you for your question. First of all, your question about why testing foreign domestic helpers and why not test their families. I think Dr. Law has already given some of the justification, but I want to say a little bit more about why are we testing foreign domestic helpers. I think that is very important because the testing, the compulsory testing notice that we are issuing, to a certain extent, it should also be targeted. The reason why we are testing foreign domestic helpers is because, first of all, this is the second foreign domestic helper that we have identified that have this new variant in Hong Kong. Not the first one, it is the second one. Secondly, according to some of the contact tracing information, there were some mingling of the different foreign domestic helpers together. So therefore, I think this gathering together or contacts are high risk to a certain extent, given there may be the incubation period. So therefore, for prudence sake, we think we should test all the foreign domestic helpers in Hong Kong. Obviously, in Hong Kong, we still have the 3-pronged strategy in testing, and there is always a voluntary testing. So for people who are worried, they can always have a voluntary testing. And for people who do not feel well, we urge them to actually go and see the doctor. Second question about the whether we will be tightening the social distancing measures. The recent social distancing measures that we have announced is under the premise of the new direction for fighting the pandemic. That is, in order to return to normalcy and not to have the opening and closing and all the different problems created from that, we are putting in a vaccine bubble as the basis, and also targeting approach. So therefore, vaccine, as I've said a few times, the two types of vaccines that we have in Hong Kong is good for protecting us from the new variant. And so therefore, one of the best way to protect ourselves from new variant is to get vaccinated. So therefore, the social distancing, so-called relaxation, is a very, very small step and also a very safe step because we put vaccine bubble into this whole social distancing measures safe relaxation. And vaccination is put into play into this whole relaxation. Finally, your question about whether we will be banning more flights, as I've said earlier, we are actually assessing the global situation every day. As Dr. Lam has earlier told you, the CHP's very stringent mechanism in monitoring the global situation and also monitoring the variants of concern through genetic testing and also their various assessment measures. So we have announced that we have added Nepal into the 3 countries that we are already, continuing the banning of boarding. We will continue to review the situation. Actually, we have also strengthened the criteria for flight suspension. That is, not only are we counting the number of confirmed cases from the airport, we are actually looking into all the different positive samples that we have identified throughout the entire quarantine period. So all the testings. So once we have identified more positive tests from a particular country, we will invoke all the measures that we have put in place in banning flights. Thank you.
好，最後一條
The lady in black.
First question to Labour Secretary. Regarding mandatory testing all domestic helpers in Hong Kong, do you afraid such measure will create kind of stigma towards the community as foreign domestic helpers were targeted in the latest infection? And the second question to Health Secretary, and is the deadline set on the 9th of May a bit too early as the mutant virus strain has a longer incubation period? Will there be a chance that a second round of mass testing is needed? And the last question to Dr. Lam, regarding the case, besides those who have been sent to quarantine, has any of the close contact of the patient with mutant virus strain have attended high-risk activities such as large group gatherings? And has she gathered with around how many other helpers during the incubation period? Thank you.
Well, we have been requiring our workers in our residential care services for more than half a year now, almost. Now it's around moving into the 15th round. There's the reason is not to sort of make it having prejudice towards any particular group. The whole consideration is about risk. I mentioned earlier on that the nature of their work is to look after family members, and many of them are very elderly. And also because of the staying in Hong Kong, and during the rest day, they have to meet their friends, take a break, but then that may cause a risk of cross-family infection. So this is the whole consideration is a matter of risk. We've been contemplating the issue for a long time. But because of this variant of concern, that increased our determination that now it is required to mandate all of them within a given period of time to be tested. As I mentioned earlier on, we are contemplating repeating this process from now on, but we will look at the progress in the next few days and see what happened and what will be the next cycle, what will be the duration, etc., etc.
Secretary Chan, please.
Okay, your question about why it is the 9th of May and whether the testing period will be longer Am I right about this question? Yeah? Okay. So I think, first of all, we want to include more time so that because the vast number of foreign domestic helpers in terms of the testing, so therefore we want to include more weekends. So this is number one, so that people can go progressively to attend the testing. Secondly, I think in terms of whether whether we will have a second batch and also third batch of testing, as Dr. Law have already said, we will look into the situation as per after the testing and monitor the situation to see that whether there is a need for more regular testing. For other, as I've said earlier, for other testing, compulsory testing that we have issued in terms of our earlier cases of new variants, we will be issuing, for example, in Cheung in Harbour City, a second or third testing as well, compulsory testing notice.
Dr. Lam, please.
For the case, she had onset of symptoms on the 23rd of April. And so if we counter back the incubation period, that is 14 days prior to the onset of symptoms, she mainly stayed at home to take care of the 10-month-old baby. And so she, during this incubation period, she just mainly visited the supermarkets, to the market, as well as went to a park with two friends. The two friends are regarded as close contact, and we have put them under quarantine. And also she had went to St. Thomas the Apostle Church, so where she performed choir, and also with audience over 200, and out of the 200 audience, we have identified 89 close contacts, all put under quarantine. And for the 10-month-old baby whom she took care, also confirmed positive with the same mutations as the case. Thanks.
好，今日嘅手嘅操多謝各位。
It's the end of the press briefing. Thank you.